Welcome to On the Beat. Today we are joined by our friends from Gastroenterology Associates of Columbus and Starkville talking about a condition called Sibo. So Dr. William Gillespie and Richard Hurd, tell us what Sibo stands for and what that condition is.
Sibo, or SIBO, stands for small intestinal bacterial overgrowth. We all have billions of bacteria that live in our system from your mouth all the way down through your colon. And sometimes the kind of population of bacteria can get dysregulated where you have overgrowth of one or multiple bacteria, and that can cause some symptoms and other issues.
So what would those symptoms be? How would I know if I have the bacteria but I have an overgrowth? How do I know that?
The main symptom that we see a lot is bloating. Diarrhea can also be an issue, abdominal pain. Those are probably the most common I see.
And what would be the cause?
There's several different causes that we know of. There's probably other ones as well, but anything that kind of messes with the motility of your GI tract can cause overgrowth of bacteria. Prior surgeries, gastric bypass, if you have diabetes that's uncontrolled, that can do it. And then there's other things like stomach acid is very helpful in killing bacteria and regulates some of the gut bacteria. So if you are on a lot of acid medicine or things like that, that can kind of predispose you to bacterial overgrowth.
Well, I was just going to ask you, what can I do to possibly avoid that overgrowth?
Yeah, there's not a lot that you can do to avoid it. I mean, we wouldn't necessarily recommend that someone not take these reflux medicines to prevent this from happening because, people need these medicines a lot. And so mostly, you want to, if you've got diabetes, you want to keep that under good control. If you have, if you've had these surgeries, you just want to be aware of the potential that could happen. It's not a dangerous thing. It can just be uncomfortable for some people.
So if you're experiencing those uncomfortable symptoms, what is the treatment? What can be done?
Generally, we treat with a round of antibiotics. There's many different antibiotics. We usually, if the first round doesn't work, we usually want to try a different one. But we usually treat for a week or two and see how people feel. And if they get better, then we don't need to do much else. But there is a high recurrence rate. So frequently we'll have to try more than one antibiotic.
Why is that? Just hard to get it under control once it's flared up? Is that make?
Yeah, and the antibiotics might not totally get rid of the overgrowth. Some of the bacteria may be resistant to certain antibiotics. And the best antibiotic is incredibly expensive and insurance doesn't cover it. So, so frequently we just have to try a couple of different medicines.
And see what works for each person. How common is this?
Pretty common.
Pretty common.
Yeah. Yeah, and to go back to your question of why does it recur, also don't forget these are things that cause it that don't generally go away. I mean, you've always got diabetes. Once you have this surgery, you've always got this altered intestinal tract. So those things, you're always predisposed to that.
Okay, but the good news is can be treated, fairly common.
Yeah.
Okay.
And we test for it with a simple breath test that you come in and have in our office. For some people, it can take a little bit of time to have it done, but it's easy to do.
Okay, sounds good. Thank you both so much. Gastroenterology Associates of Columbus and Starkville. That's today's On the Beat.